dignity. We need to start creating sustainable jobs that will benefit the community as a whole. We're not looking to bring in companies that refuse service such as a grocery store. The Tenderloin is in desperate need of a grocery store. What we need to do is get a co-op that benefits the community, that hires from within the community, and returns its money to the community. And once we've established that, we're going to start using that as a point where we can start delivering food to seniors and elders who only, on average, eat one meal a day. And when we have control, we can control the pricing and we can control the benefits, and it's all going to go back into the neighborhood. And then Matt was talking a little bit about the safety in the neighborhood. I think it's because there is no dignity offered to the people on the streets who need to have the dignity to start moving on. Safe injection sites have been proven in many countries around the world to be not only a good addition to a neighborhood with a 99% approval rating in most cities that they exist in, but they also take people off the street, they remove sharps from the street, and we no longer have to send people to the hospital for overdoses, for infections, for any of the number of things, HIV, hepatitis C. We control all that spending by having nurses on staff who give out clean needles and remove that from the street and give dignity to the people who are using. And it is a proven model and something that I wholly support, and I think that would really benefit the Tenderloin especially. Affordable housing. One of the things we have to do is we have to go out after the Art Academy University and get that housing back. There is no need for them to have bought up 47 rent-controlled buildings, be running them in a poor manner with becoming poor neighbors and making $1.5 billion in profit off of shoving 8 or 9 people into a 2-bedroom apartment with 1 closet. There needs to be some accountability on that level. And we also need to hold the Planning Commission accountable for why they allowed this to happen. They also bought up 11 SROs in San Francisco, and we need to return this kind of housing to the people who need it the most, because that's why displacement is the #1 reason why people are homeless. And to create affordable housing, I think that needs to go into harm reduction as well. And what I think is that if we combine San Francisco Health Services and Healthy San Francisco into one pool, and we have all of the benefits of that larger pool, we can start offering better health care. We can start putting housing, such as housing for mentally incapable people who are living on the streets and probably the #1 reason for violence. So if we can start taking care of these people and start doing harm reduction with housing, with safe injection sites, and making it all part of Healthy San Francisco, that way we combine everything, we have more focus, and we have more people working together for a better solution for San Francisco. Thanks.